And it's my pleasure to introduce Dr. Pooja Khamar. She's going to speak on. Are you speaking? Yeah. Your name is. Okay. What are you speaking on? No, no, no. This must be old one. Just yeah, I know. And she also happens to be his proud niece. And so she's speaking on genes. I think we had a beautiful talk by Dr. Moita ma'am about the whole red eye diseases. And what is happening is we will show that the drug you showed, I think Dr. Purna Chandra is here, and he is working on retinal gene therapy. How much does that drug cost? It's the costliest drug in the world, if I remember, 8 crores. 6.4 crores. I believe they give you every time you order, you give 2 injections by mistake if you drop it. So Pooja is trying to say how you can bring it and affordable to your registry you're doing. This is directly connected to it. The whole vision is that it should be so affordable, like what people can afford a simple surgery. Dr. Pooja.
Thank you, sir, and I would like to thank Cipla for organizing this session, which is a little bit unique, and it gives us a lot of views also outside. So Mohita ma'am has already made my job simple in saying that yes, you do need gene therapy for rare eye diseases. I'll just be very quick in what we are doing at NN and what is the future, what will be the future in other diseases as well. So lysyl oxidase. Lysyl oxidase is something which is there in your cornea all the time in the stroma, and that is an enzyme, a gene which keeps your collagen bundles in place. And this is how it should be. But if the lysyl oxidase, the blue dots, what you're seeing is on the lesser side, your collagen bundles, they start slipping away. And that's when your corneal ectatic disorders start, which is known as keratoconus. And this is how it will be. So you need, so this is when the keratoconus happens, and if it's lesser, it keeps progressing. So you need optimal lysyl oxidase levels, which are these blue enzymes, and this is how it is represented in the cornea to have a good effect and to prevent the corneal ectatic disorders. Now, there are various publications which have happened where it suggests that the lysyl oxidase levels are lesser in the keratoconic eyes compared to that of controls. And with increasing grades of keratoconus, here you can see the lysyl oxidase levels are lower. So that means that lysyl oxidase is one of the culprits in your corneal ectatic disorders. And if the lysyl oxidase levels are on the lesser side, just to be a very quick brief, if it's on the lesser side, then even if you cross-link these patients, there are very high chances that these cross-linking patients are going to have a failure of cross-linking. So that is why lysyl oxidase is important. You might have very good collagen levels, but if the lysyl oxidase is on the lower side, then even if you do cross-linking, everybody will say that cross-linking is there for keratoconic patients. Why do I need a gene therapy? But if the lysyl oxidase level is lesser in your cornea, then even if you do this cross-linking, it's going to fail. That is why it is important. So the question here is that can we have a gene therapy in corneal ectatic disorders? I will not go into detail of what it is, but there is something like AAE vectors, which is nothing like a gene editing, where if there is a defective gene, when you inject these vectors, it goes to this defective area and it tries to edit that area and goes and sticks there. So that is what AE vectors do, and that is what we have been working on. And as they just mentioned that how expensive the gene therapy can be, we have increasing disorders in gene therapy, and more people will need gene therapy with time. So what we are trying to do at Narayan Netralaya is we are trying to build our own clinical grade vector facility in India, where we can manufacture these vectors in India, and it will be a true made in India gene therapy for all the patients, and it will be as cost effective as possible because it's a true make in India product. So it's not easy to do a gene therapy. Like, it's not easy to build these gene therapy vectors because first of all, you cannot have a lab and you can make these vectors. You need class 100 room facility, a clean room facility where your normal person cannot go. You have to wear those space suits and go inside, and all the time you have to be in the space suits. You have to sterilize these rooms all the time. And then every product which you take inside also has to be clean, sterilized before you use it. So it's a lot of work which happens behind developing a gene therapy vector. And during any of this process, if the vector gets infected, your entire vector goes waste. You have to produce it again. So that is why this gene therapy is expensive, and it's not easily available, and it's not very successful. So what we are trying to do is we are trying to bring it in India and make it as cost effective as possible. Now, sorry. So now so the question comes here is, what route do we do? Like, because it's a corneal gene therapy, there will be retinal. So there will be various modes of administrations, like topical drops, intrastromal injections, intracameral injections, subconjunctival injections. So based on what level of the eye you want to treat, you can choose it. So we are trying to work on topical drops or intrastromal injections for corneal gene therapy, which will help us. So what we took two models to begin with. We took the mouse model where Dr. Tirumalesh helped me, because it's very difficult to work in those small eyes. So he did intrastromal injections of lysyl oxidase vectors and the controls in those mice models. And then me and Dr. Rohit sir, when we were doing the smile surgeries, the lenticules which we remove, we did not discard them. We sent it to the lab, on which the same lenticule of both the patient, one eye got treated as with controls and the other eye got treated with the gene therapy vectors. We did it for 4 weeks. We treated them for 4 weeks, and after 4 weeks, we saw what the expression of this molecules was. So the first thing what we found was that, if you can see these graphs, yes, it was working. These are all the contralateral eyes in the human donor lenticules. When you inject the lysyl oxidase vectors, the expression is increasing. The other thing what is increasing is when the gene lysyl oxidase vector increases, the collagen level increases, so that maintains the stability of your eye. But the other interesting part was, everybody talks about inflammation, keratoconus and inflammation. That whenever there is keratoconus, there is inflammation, and because of inflammation, the disease keeps progressing, and that's when your treatments fail. What we found interesting, the aim was never to treat inflammation. The aim was always to have lysyl oxidase, increase the lysyl oxidase vectors. When we treated this lenticules with lysyl oxidase vectors, the AEV vectors of lysyl oxidase, this is the control and this is the lysyl oxidase part, the inflammation actually came down. So
This is a very important thing which Ashish and Tirumlesh, Poonachand, all of you are, I mean, there are many retina surgeons here, is your driver of how a body reacts is determined by your genetic factors. Like you mentioned about TAS, we just spoke about TAS. Some people have a higher threshold of how they would respond to an inflammation, and it's driven by inflammation, inflammatory genetics, inflammatory genes. And this particular slide was an eye opener, that you change the gene and your inflammation suddenly drops. And that's a classic example of how our body is controlled. And many times we blame a drug or a drop when there's an excessive reaction. It may be just that the drops may be behaving in excessive way because your body is genetically primed for behaving in excessive way. It's like emotions. I scream at her, I scream at him. The both of how they react would be different. That's the genetics. That's the molecules. That's why we call it as molecules of emotions.
So this is what we found, and that was a very positive point in our study, that just with lysyl oxidase therapy, you can control inflammation. That will in turn help us in future as well. And the same findings we found on the mouse cornea model. So that was the same findings. But next, what we wanted to do is we want to bring it to the patients. So when you're doing a phasic trial, before we inject these vectors into patient's eye, we had to see what will be the right route of this delivery, whether it will be drops, whether it will be intrastromal injections, or what. So what we are doing currently is we have applied for a patent. I think today only they are going to apply for it. uh, so what we did was we took cadaveric eyes, and we have we have tried different ways, but this time we created a channel using the IFS.
IFS has a channel for, used to have a channel for presbyopia implants. Nobody uses it here. I think Tejas Shah used to use it once upon a time. So that's a good method to inject your vector, the virus inside.
And we injected him in the cadaveric eye, and we had to seal this wound because we didn't want the vectors to come out, because the squeezing of the tightness of the eye can squeeze it out. So we had to seal it with glue. And this is just initial data. Of course, these are healthy eyes, so we do not have lysyl oxidase for lower to begin with. But this is the control arm, and this is the lysyl oxidase arm. You can see how the collagen bundles, you can see the spacing between all of them. You can see some space here. And with the lysyl oxidase AE vectors injected, you can see the space of the collagen is getting closed. And here also you can see that how nicely the density of the ECM layer near the injection site is increased. And this is the second image. What you see is the denser the brown means more the lysyl oxidase activity, and here it's lesser. This is the control, and this is the vector. And so what we trying to say here is that it's working when we are trying to do a pocket, and it is increasing and helping in increasing the lysyl oxidase activity. And not just that, but this is an early work on the strength. So like you can do an, yes.
Working in the pocket area, or if it's working in general?
In general,
In
because this
general.
was an
So
histopathological
this is the
thing.
entire cornea. So
And what is important is, see, if you can see, there is no collagen at all. And suddenly with the gene, the collagen starts producing. And this is this is what you would see if tomorrow a healthy person's cornea is taken up.
So, but yeah, we need to still do more studies to see at how much effect it will stay and for how long. And this was done in goat's eye, where we had again injected this vectors the same way. And after 6 weeks, they had to be sacrificed. The goat's eye had to be excised, and we did nano indentation technology to see if the strength, because of the injection of this vectors, whether the strength is actually increasing or not. And you can see the difference. These are the controls, and these are the LOX injected eyes. And you can see the increase in the elastic modulus of this corneas as well. So the LOX gene therapy can be a potential factor for keratoconic patients, and it also, in addition to it, also helps in reducing the inflammation.
We are just planning to hopefully bring it to clinical use this year once we get the regulatory affairs clear. Yes, Ashish? Sally, you can get ready.
Zero knowledge of cornea, but it's look very interesting. So, just one quick question, Rohit. Are you guys, I'm not sure of that, is do you guys do a gene mapping to find out the candidates before you
See, one thing which is, I mean, I understand where you're leading. For example, you're looking at retinoid pigmentosa, which is Pune is working on. You need a mapping because you have different genes which can be mutated. In lysyl oxidase, every keratoconic eyes, the lysyl oxidase is lost, irrespective of what gene is being mutated. So you don't need a candidate gene to be identified. For example, if he is planning for an injection of retina, you have to work on RP65 or in your Stargardt's ABC one. But here, it the mechanism is that it's not there. It does not exist. So that is why it is much more easier on a cornea. In fact, we were looking at it whether we can use it on a drop format, but the drops does not go in. And interesting thing is, interest of time, we're not shown. You inject the gene. For Purna's also is the same child. How do you off the gene? It's like that ever ready battery. The rabbit keeps running. So what we have to do is doxycycline is a regulator. So you have to use a doxycycline where you need, once you know it's getting stronger, you have to stop. In the first experiment, what they did with rabbits, you injected it, the rabbits died of heart attack because it made it whole body the heart stopped pumping because the lysyl oxidase created non-functional heart. So experiments are really different.